Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. Which of the following puts the layers of skin in correct order from right to left? A. Dermis, epidermis, hypodermis. B. Hypodermis, epidermis, dermis. C. Epidermis, dermis, hypodermis. D. None of the above. Correct answer: C. Epidermis, dermis, hypodermis. The layers of skin from outermost layer to innermost layer is the epidermis, dermis, and the hypodermis. 2. The loop of Henle is located in which of the following body organs? A. Liver. B. Kidney. C. Heart. D. Ear. Correct answer: B. Kidney. The loop of Henle is located in both kidneys and is the site of action for loop diuretic medications. 3. In which of the following methods should a nurse assess for scoliosis in a child? A. The child should stand with both arms reaching forward while the nurse measures the difference in arm lengths. B. The child should stand with her back against the wall while the nurse views her from the side. C. The child should bend over at the waist while the nurse looks for asymmetry in the back. D. The child should sit in a chair while the nurse checks for both feet to be flat on the floor. Correct answer: C. The child should bend over at the waist while the nurse looks for asymmetry in the back. Screening for scoliosis often involves the Adams forward bend test. This test asks a child to bend over at the waist to touch the toes. The nurse assesses the child's back to look for asymmetry of the ribs, uneven shoulders, or one hip that is slightly higher than the other. 4. Which of the following is an example of a natural family planning method? A. Basal body temperature. B. Intrauterine device. C. Periodic abstinence. D. All of the above. E. Both A and C. Correct answer: E. Both A and C. Natural family planning is a method of birth control that does not use artificial means to prevent conception. Instead, couples may determine a woman's fertile time and take measures to avoid fertilization, such as through withdrawal or abstinence. Basal body temperature measurement is one method of determining a woman's fertile period. Once this is determined, couples can abstain from intercourse to reduce the possibility of conception from occurring. 5. Which of the following is an example of a teratogen? A. Cholase. B. Diphenhydramine. C. Warfarin. D. Acetaminophen. Correct answer: C. Warfarin. Teratogens are substances that, when taken during pregnancy, can cause birth defects or abnormalities with the unborn baby. Nurses should be aware of common teratogens and counsel clients about what substances to avoid during pregnancy. Warfarin is a type of teratogen because it can cause birth defects or excessive bleeding in the fetus. 6. An 8-year-old child has been diagnosed with infectious conjunctivitis. Discharge instructions will include: A. Good hand hygiene is critical. B. The child should be kept home from school for a week. C. Antibiotic drops or ointments will not be effective. D. Eyes should be irrigated with sterile saline. Correct answer: A. Good hand hygiene is critical. The child must understand the importance of keeping his hands away from his eyes and washing his hands often. Irrigation of the eyes is not therapeutic and may cause more irritation than relief. Antibiotic drops or ointment will usually be prescribed. Because this disease is so contagious, it is critical that the child be kept home from school for 24 hours after treatment starts or until symptoms subside, typically in 1 or 2 days. 7. A child is being discharged to home with a diagnosis of ringworm. Discharge instructions should include the information that A. The infection is caused by a worm and cannot be passed from person to person. B. The infection is caused by a virus and can be passed from person to person. C. The infection is caused by a bacteria and cannot be passed from person to person. D. The infection is caused by a fungus and can be passed from person to person. Correct answer, D. The infection is caused by a fungus and can be passed from person to person. Ringworm is caused by a fungus and not by a worm as its name implies. This infection can be passed easily from one person to another. The fungus can also be passed through infected items such as combs, clothing, or shower surfaces. Pets can also carry the fungus. 8. A child presented to the ED with itchy scalp, irritation of the scalp, and infected areas on the child's head. Assessment reveals lice and nits in the child's hair. Discharge instructions will include A. Permethrin 10% applied to hair and body after shower and shampoo. B. Manual removal of nits must be done for several days to ensure they do not hatch. C. Washing sheets and towels in hot water. D. Child should not return to school until all lice and nits are gone. Correct answer, C. Washing sheets and towels in hot water. Sheets and towels should be washed in hot water to remove any lice. The CDC and American Association of Pediatrics both recommend that no-nit policies in schools should be discontinued. Although nits may persist after treatment with permethrin 1%, not 10%, they are usually not viable and are unlikely to hatch into crawling lice. The child should be checked a week or 10 days after treatment to determine if all lice have been removed. 9. Johnny Tate, a 2-year-old boy, is hospitalized with pneumonia. This child will most likely underscore A. Lie quietly as the nurse listens to his lung. B. Ask many questions about what the nurse is doing. C. Fuss, cry, and push the nurse away. D. Plays cheerfully with a stethoscope. Correct answer, C. Fuss, cry, and push the nurse away. Johnny will most likely fuss, cry, and reject strangers. A 2-year-old is considered a toddler. Toddlers typically demonstrate negative behavior. They are hesitant around strangers and they resist close contact with people they do not know. They react to separation anxiety when their parents are not close to them. They do not yet have good language skills, so they often cry in order to communicate their distress. 10. Identify the developmental task with the correct age group. A. Infancy, autonomy. B. Toddler, initiative. C. Preschool child, trust. D. School-age child, industry. Correct answer, D. School-age child, industry. The developmental task for the school-age child is industry. The infant's developmental task is trust and the toddler's developmental task is autonomy. The developmental task for the preschool child is initiative. 11. A victim of a gunshot wound to the abdomen has been admitted to the hospital, accompanied by a police officer. When questioned, the officer states that the patient is a suspect in a homicide, which occurred as part of the same incident. A small child was killed as the result of a stray bullet. The patient is combative, yells that he's in pain and demands medication. What is your most appropriate response? A. Tell him you'll take care of him after your other patients. B. Reinforce restraints. C. Perform a pain assessment and administer pain medication. D. Ask the officer for more details of the incident. Correct answer, C. Perform a pain assessment and administer pain medication. The most appropriate and caring response is to perform a pain assessment and administer the pain medication that has been ordered. Regardless of personal feelings about any given situation, the nurse's responsibility is to provide unbiased, appropriate and supportive care, as stated in the American Nurses Association (ANA) Code of Ethics. 12. Ruth is a 72-year-old patient who has been upset and crying all morning. When asked why she is upset, she turns toward the wall in silence. What collaborative process may be helpful in caring for this patient? A. Speak with the patient care technician. B. Call the chaplain. C. Call the social worker. D. Call the patient's husband. Correct answer: speak with the patient care technician. Collaborating with the patient care technician is an excellent option in this situation. Patient care technicians and nurses' aides provide some of the most hands-on and intimate care that patients receive. Often, patients feel more comfortable discussing feelings and building relationships with these individuals than others. 13. The previous charge nurse fell during her shift and was taken to the emergency room. You have been assigned to take over as charge nurse without any report. At the end of the shift, you have made the assignments for the next shift's nurses and posted them. As the nurses come in, they begin to complain that the assignments make no sense, based on patient acuity. One refuses to take her assignment and threatens to go home. What could you have done to prevent their dissatisfaction? A. Reviewed the notes of the previous charge nurse. B. Tried to contact the previous charge nurse in the emergency room. C. Collaborated with the nurse manager. D. Collaborated with the other nurses on your shift. Correct answer: D. Collaborated with the other nurses on your shift. Collaborating with the other nurses on your shift would have permitted them to provide the most updated information regarding patient status and acuity. Requesting their input into creating assignments would have provided shared governance and assurance that the unit staffing was arranged appropriately. 14. You have noticed that the last several patients you have cared for have had questionable blood pressure readings from their arterial lines. When checked against cuff pressures, a discrepancy has been noted, and further investigation has revealed faulty transducers. This is not the first product issue with this company. What positive step could you take to help resolve this situation? A. Use the old stock from a previous company. B. Verify the cuff pressures every hour to ensure accuracy. C. Notify the risk manager. D. Form a peer work group to evaluate new products. Correct answer: D. Form a peer work group to evaluate new products. Forming a peer work group to evaluate new products would be an excellent opportunity for collaboration among peers, management, and the purchasing department. When clinicians are engaged to work towards solutions that address patient care issues, they experience more empowerment and control over their work environments. 15. Which of the following is an organizational factor that affects workplace violence directed at nurses? A. Clients who have short hospital stays. B. The presence of security guards. C. Restricted client areas. D. Understaffing of nursing personnel. Correct answer: D. Understaffing of nursing personnel. Understaffing of nursing personnel may be an organizational risk associated with workplace violence for nurses. Understaffing involves too few nurses on duty, which may not be enough to meet client needs at the time or may result in longer delays for provision of care. Greater amounts of activity and diminished numbers of nurses to provide care may result in aggression, violence, or anger from clients or families directed towards staff. 16. Your patient is concerned about their health insurance and the costs associated with their hospital care. Which of Maslow's needs is your patient expressing? A. Physical needs. B. Security needs. C. Self-actualization. D. Self-esteem and the esteem of other. Correct answer: B. Security needs. Health and life insurance are examples of security needs. 17. Verbal bullying among school-aged children threatens which of Maslow's needs? A. Physical needs. B. Self-actualization needs. C. Love and belonging needs. D. Safety needs. Correct answer: C. Love and belonging needs. Verbal bullying among school-aged children threatens the love and belonging needs of these young children. They want to be accepted by others as a member of their peer group. Bullying of all kinds is not acceptable. 18. Physical bullying among school-aged children threatens which of Maslow's needs? A. Physical needs. B. Love and belonging needs. C. Safety needs. D. All of the above. Correct answer, D. All of the above. Physical bullying can injure a person. Physical needs. It can also threaten the child's psychological and physical safety and security, in addition to the fact that all bullying, including physical bullying, leads to a person feeling rejected, rather than loved and belonging to the group. 19. Your patient has had a very full and rewarding life. She has had a lot of success in her personal and professional life. She has achieved all of her goals and she has maximized her potential. This patient can be best described as a person who has achieved Maslow's _ self-actualization. B. Exploration. C. Closeness. D. Protection. Correct answer, self-actualization. This person has moved along Maslow's hierarchy and is now self-actualized. Exploration, closeness, and protection are not part of Maslow's hierarchy. 20. Living will is another term for _ A. DNR. B. Advanced directives. C. NPO. D. At the end of life. Correct answer, B. Advanced directives. A living will is another term for advanced directives. Patients and residents across the country are encouraged to write what treatments they do and do not want when they are at the end of life. These things are put in a living will or advanced directives. 21. Another term for healthcare proxy is _ medical power of attorney. B. Durable power of attorney. C. Limited power of attorney. D. A living will. Correct answer, medical power of attorney. Another term for healthcare proxy is medical power of attorney. This proxy makes medical decision for the patient when the patient is no longer able to make decisions. 22. A prescription for amoxicillin 250 mg capsules, 1 cap per tid x 10 days should be filled with _ 15 capsules. B. 20 capsules. C. 30 capsules. D. 35 capsules. Correct answer, C. 30 capsules. The correct answer is 30 capsules because 1 capsule taken 3 times daily, tid equals medical term for 3x is daily, for 10 days or 1 times 3 times 10 is equal to 30. 23. How many ounces make up 1 cup? A. 8. B. 16. C. 32. D. 60. Correct answer, A. 8. There are 8 ounces in 1 cup. This conversion of measurement is often used when preparing and administering solutions and suspensions. 24. There are _ ounces, ounce, in a pound, lb. A. 4. B. 6. C. 8. D. 16. Correct answer, D. 16. There are 16 ounces in a pound. This is a common conversion that is used when weighing material on a scale. 25. Milli is equal to _ A. 1/1000th of the basic unit. B. 1/100000th of the basic unit. C. 1/1000th of the basic unit. D. 1/100th of the basic unit. Correct answer, C. 1/1000th of the basic unit. Milli is equals 1/1000th of the basic unit. 26. A fluid ounce is made up of how many ml? A. 30. B. 65. C. 454. D. 2. Correct answer, 30. A fluid ounce is comprised of 30 milliliters. This is a commonly used conversion when preparing solutions and suspensions. 27. Kilo is equal to _ A. 1/100000th of a basic unit. B. 1/100000th of a basic unit. C. 100 times the basic unit. D. 1000 times the basic unit. Correct answer, D. 1000 times the basic unit. Kilo is equal to 1000 times the basic unit. 28. How many cc's make up 1 pint? A. 280. B. 380. C. 480. D. 580. Correct answer. C. 481 pint is composed of about 480 cubic centimeters or 480 milliliters. 29. How many quarts make up a gallon? A. 10. B. 3. C. 5. D. 4. Correct answer. D. 4. 4 quarts make up 1 gallon. 1 gallon, 3,480 milliliters, is composed of 8 pints. 2 pints equals 1 quart. 30. How many micrograms mcg make up 1 milligram mg? A. 10. B. 100. C. 1000. D. 10,000. Correct answer. C. 1000. 1000 micrograms mcg make up 1 milligram mg. This conversion is often used to calculate medications for intravenous, and oral use. 31. There are milligrams mg in a gram g. A. 10. B. 100. C. 1000. D. 10,000. Correct answer. C. 1000. 1000 milligrams mg make up a gram g. 32. A teaspoonful is the same measurement as underscore. A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 5 milliliters. Correct answer. D. 5 milliliters. 5 milliliters makes 1 teaspoonful. This unit of measurement is often used to administer medication to children and elderly patients. 33. If a patient is receiving 7 liters of 4 fluids over 10 hours, how many ml will the patient receive per minute? A. 12.8. B. 11.5. C. 11.7. D. 13.2. Correct answer. C. 11.7. The patient would be receiving approximately 11.7 milliliters per minute. This is found as follows. Convert the 7 liters to milliliters by multiplying 7 times 1000 is equal to 7,000 milliliters. Divide the amount of fluid by the total time of infusion. 7,000 milliliters per 10 hours equals 700 milliliters per hour. Divide the total number of milliliters per hour by 60 minutes. 700 ml/60 minutes equals 11.666. Round to the nearest tenth to get the answer. 11.7 milliliters, 34. If a patient is receiving 3.5 liters of 4 fluids at a rate of 7 milliliters per minute, how many hours will the 4 fluid last? A. 6.4. B. 7.3. C. 8.3. D. 9.2. Correct answer. C. 8.3. The 4 fluids would last approximately 8.3 hours. This is found as follows. Convert 3.5 liters to milliliters by multiplying 3.5 times 1000 is equal to 3,500 milliliters. Divide the total amount of fluid by the amount received per minute. 3,500 divided by 7 is equal to 500. This indicates that the 4 fluid would last for 500 minutes. Convert minutes to hours. 500 divided by 60 is equal to 8.333333 hours. Round to 8.3 hours. 35. Many nurses are not comfortable dealing with the topic of suicide with a patient who may be at risk. Of the following, what would be an appropriate action if a patient uses language indicative of suicidal intentions? A. Ask if the patient has a plan. B. Ask the patient to describe details of the plan. C. Ask the patient to agree to a no-harm contract. D. All of the above. Correct answer. D. All of the above. All of the options noted are important aspects of providing a suicide assessment and intervention with patients who may be indicating such thoughts. Most patients are relieved to be able to talk about their thoughts with a caring professional. The more detailed the patient's plan, the more serious they typically are about carrying it out. Use of a no-harm contract helps the patient take control of his own behavior and empowers him in his care. Such contracts are not a legal document, but a suicide prevention tool in which certain steps are outlined that the patient agrees to take if he has thoughts of suicide. The substantive agreement by the patient is that by no means will he die by suicide, with specific steps to take and contacts to make in the event of suicidal thoughts. Patients who have indicated suicidal thought and intent must be monitored closely with 1:1 observation and receive care directed by a multidisciplinary team in order to experience optimal outcomes. 36. A client in a long-term care facility has developed reddened skin over the sacrum, which has cracked and started to blister. The nurse confirms that the client has not been assisted with turning while in bed. Which stage of pressure ulcer is this client exhibiting? A. Stage I. B. Stage 2. C. Stage 3. D. Stage 4. Correct answer, B. Stage 2. A stage 2 pressure ulcer develops as a partial thickness wound that affects both the epidermis and the dermal layers of skin. The client may develop skin that is red, with blisters or cracking. The wound may appear shallow and moist. The ulcer does not extend to the underlying tissues at this stage. 37. A. Nurse is preparing to administer a dose of platelets to a client. Which of the following actions must the nurse perform before giving the platelets? A. Start in 4 of 1/2 normal saline to administer with the platelets. B. Ensure the container with the platelets is intact and not damaged. C. Verify the client's name and address. D. Check the client's chart to ensure he is not taking any antibiotics. Correct answer, B. Ensure the container with the platelets is intact and not damaged. Before giving a transfusion of blood products such as platelets, the nurse should ensure that the solution is in an intact container that does not have any leaks or drainage. Cracks in the exterior container of blood products can allow bacteria to accumulate, which can cause an infection. 38. According to the American Heart Association standards, high-quality CPR for an adult includes all of the following except A. Push hard. B. Push fast. C. Allow chest recoil between compressions. D. Pause CPR as each drug is administered. Correct answer, D. Pause CPR as each drug is administered. CPR should not be interrupted for drug administration. CPR should be applied at a rate of at least 100 per minute, at a depth of at least 2 inches for adults, allowing recoil of the chest between compressions. 39. One of your patients is dependent on a mechanical ventilator for their respiratory needs. The patient cannot breathe on their own. Suddenly, the lights in the patient's room and the entire nursing unit go off. You realize that the electric power has been lost. What is the first thing that you should do for this patient? A. Plug the ventilator into the red outlet in the room. B. Plug the ventilator into the blue outlet in the room. C. Use an amber bag to ventilate the patient. D. Call the doctor about this emergency. Correct answer, A. Plug the ventilator into the red outlet in the room. All hospitals, nursing homes and other healthcare facilities must have emergency generators in case the electricity supply ends. Healthcare facilities have red outlets that will work in the event of a power outage because they are connected to the emergency generator. 40. Which would be the first step when a patient passes out at the front desk? A. Call 911. B. Initiate CPR. C. Shake the patient and ask if he is okay. D. Check for a pulse. Correct answer, C. Shake the patient and ask if he is okay. Anytime a patient passes out or appears to be sleeping, shake the patient to see if you can rouse him. Checking for a pulse, calling 911, and initiating CPR would all follow if the patient does not become alert. 41. When performing CPR, at what rate should chest compressions be applied? A. 100 per minute. B. 60 per minute. C. As quickly as possible. D. 200 per minute. Correct answer: A. 100 per minute. Chest compressions given during CPR should be done at a rate of 100 compressions per minute. 42. Which acronym would best describe the procedure for assessing a patient that appears unconscious? A. WBC. B. QRS C XYZ. D. ABC. Correct answer: D. ABC. The ABC method stands for airway, breathing, circulation. When encountering a patient who appears unconscious, first assess for adequate airway by performing the head lift, chin tilt. Next look, listen and feel for breathing. Finally, check for a pulse. 43. A nurse is caring for an 86-year-old client with decreased visual acuity and who uses a cane for mobility. What should the nurse teach this client to reduce the risk of falling at home? A. Take off shoes while in the house and wear only socks. B. Limit activities to the lower level of the home. C. Keep a lamp near the door of every room. D. Install non-slip pads in the shower or bathtub. Correct answer: D. Install non-slip pads in the shower or bathtub. To prevent the risk of falls at home, clients may install non-slip pads on the floor of showers or bathtubs where excess water may accumulate. The nurse can teach the client how to prevent falls by providing education about moving safely at home, such as keeping a light by the bed, wearing non-slip shoes, and navigating stairs carefully. 44. A nurse is preparing to assist a client from his bed into a wheelchair. Which action is essential to maintain client safety in this situation? A. Position the wheelchair at the foot of the bed. B. Maintain a space of at least 12 inches between the wheelchair and the bed. C. Place the foot plates in the lowest position before transferring the client. D. Lock both wheels on the wheelchair before moving the client. E. Both B and D. Correct answer: D. Lock both wheels on the wheelchair before moving the client. When transferring a client from a bed to a wheelchair, the nurse must ensure several safety measures are in place to prevent injury during the transfer. Locking both wheels on the chair stabilizes it as the client gets in and out. The wheelchair should be next to the bed, with foot rests up until after the client is seated. 45. A 76-year-old male patient is being admitted to the hospital with abdominal pain S/PA left total hip replacement 5 days ago. The patient has active bowel sounds, denies vomiting. The patient states his last bowel movement was this morning and was loose and brown. Which of the following has likely occurred? A. Constipation. B. Impaction. C. Diarrhea. D. Fecal incontinence. Correct answer: B. Impaction. Impaction occurs when stool is stuck in the rectum and diarrhea leaks around the stool. Increased age, post-op status, probable narcotics, and decreased mobility place the patient at risk for impaction. The nurse should use a lubricated, gloved finger to remove the stool little pieces at a time. The nurse must watch for stimulation of the vagus nerve during this procedure. 46. A client who suffers from a neuromuscular disability wants to try Feldenkrais to increase some flexibility. Which of the following best describes this alternative healing method? A. The client uses mind/body exploration to increase awareness. B. Fine needles are placed along certain points in the body to promote energy flow. C. Intravenous injections of amino acids work to detoxify the body. D. Magnets are applied to parts of the body that are causing the greatest issues. Correct answer: the client uses mind/body exploration to increase awareness. Feldenkrais is an alternative treatment therapy that uses mind and body techniques to increase awareness to retrain neuromuscular function. This method may also be used to increase flexibility and agility, both physically and through patterns of thought. 47. A new nurse is orienting to a geriatric medical surgical unit. She questions why the unit protocol is to perform mouth care every 2 hours and as needed. The staff nurse explains that the following factors contribute to dry mouth in the older adult: A. Increased saliva production, diuretics. B. Decreased saliva production, diuretics. C. Increased saliva production, antibiotics. D. Decreased saliva production, antibiotics. Correct answer: B. Decreased saliva production, diuretics. Older adults are at increased risk for dry mouth secondary to decreased saliva production and the use of antihypertensives, diuretics, anti-inflammatory agents, and antidepressants. 48. At the end of your shift, Sophie T starts crying when you walk into their room. Sophie is usually very cheerful. You speak to Sophie and she tells you that she is very sad because she has not seen her family in weeks. What should you do? A. Listen to Sophie with genuine concern. B. Tell Sophie that she should not cry. C. Immediately call the family so Sophie stops crying. D. You should leave because your shift is over. Correct answer: listen to Sophie with genuine concern. You should listen to the Sophie and her feelings with genuine concern and compassion. Patients and residents should be allowed to ventilate their feelings. Listening is a part of good communication. You should not tell the person to stop crying. This is not helpful. 49. The primary reason that people act out with disturbed behavior in a healthcare facility is because the person has a problem. A. Social. B. Spousal. C. Thinking. D. Physical. Correct answer: C. Thinking. The primary reason that people act out with disturbed behavior in a healthcare facility, like a nursing home, is because the resident has a thinking problem, like dementia or Alzheimer's disease. Social problems, spousal issues, and physical problems may, at times, lead to some degree of poor behavior. However, it is thinking problems that most often lead to disturbed behavior. 50. The best way for a nurse and a healthcare facility to control the effects of poor and disruptive patient behavior is to underscore: A. Prevent it. B. Restrain the patient. C. Medicate the patient. D. Isolate the patient. Correct answer: Prevent it. The best way to manage and control the effects of poor and disruptive patient behavior is to prevent it from happening at all. Restraints and isolation are a last resort, and not a good way to manage behavior. They simply prevent injuries to self and others. Medications to control poor behavior are called chemical restraints and, like physical restraints, they are not recommended. 51. Identify the trigger type with the correct trigger that can possibly lead to disturbed behavior. A. Emotional, room coldness. B. Environmental, boredom. C. Physical, pain. D. Communication, silence. Correct answer: C. Physical, pain. Pain is an example of a physical trigger that can lead to disturbed behavior, particularly when the resident, or patient, is unable to express this pain to their healthcare providers. Room coldness is an environmental trigger, boredom is an emotional trigger, and silence is a part of communication and not a trigger for poor behavior. 52. Jerry is a 55-year-old veteran who has been admitted after a motor vehicle accident with multiple injuries. His friend reported that he had been using synthetic marijuana prior to the accident, and that he also sees a psychiatrist at the VA hospital for an unknown diagnosis. He stated that Jerry sometimes gets hyper for no reason, starts ranting, and becomes violent. Of the following, which general psychiatric disorder is characterized by a pattern of aggression or violence which includes irritability, agitation, and violent behavior during manic or psychotic episodes? A. Schizophrenia. B. Post-traumatic stress disorder, PTSD. C. Bipolar disorder. D. Delusional disorder. Correct answer, C. Bipolar disorder. The pattern of aggression or violence of bipolar disorder includes irritability, agitation, and violent behavior during manic or psychotic episodes, which is highly comorbid with substance use, which worsens the prognosis. The Diagnostic and Statistical Manual of Mental Disorders identifies several disorders which may carry a higher risk for violent and/or aggressive behaviors, which is a concern when patients with comorbid psychiatric disorders are admitted to the ICU or general floor for medical surgical needs. 53. Of the following, which would not be helpful to include when developing Jerry's plan of care? A. Limiting choices. B. Providing structure. C. Encouraging patient input. D. Ensuring availability of PRN medications. Correct answer, A. Limiting choices. Limiting choices would not be helpful in Jerry's plan of care. Providing options, even if between limited choices, provides the patient with a sense of independence as opposed to controlling the patient, integrity versus shame. Providing structure is very important, something which patients receive on a psychiatric unit, but may lack on a medical surgical unit. Encouraging patient input into identification of triggers and methods which have been effective for relief/control of aggressive impulses is critical to both empowering the patient and individualizing the plan of care. Ensuring availability and prompt delivery of PRN medications provides the patient with a sense of control and safety, knowing that they will be able to obtain needed medication when requested. 54. Of the following, which often triggers an episode of violence or aggression by the patient with a psychiatric diagnosis that may involve violent behavior? A. Obtaining a history. B. Asking for input into care. C. Enforcing rules. D. Taking a walk. Correct answer, C. Enforcing rules. Enforcing rules is often a trigger for the patient with a psychiatric diagnosis that may involve violent behavior. Limit setting or denying patient demands is often interpreted by the patient as a means of control and intimidation, which can lead to aggressive or violent behavior. Anticipation of this potential and responding with calm, appropriate, and professional behavior by nursing personnel is critical to resolving conflict and preventing escalation of the situation. Both avoidance of such patients and matching emotion with them are detrimental for all parties involved. 55. Which of the following is an appropriate tension reduction intervention for the patient who may be escalating toward aggressive behavior? A. Asking to speak to someone. B. Asking to be alone. C. Listening to music. D. All of the above. Correct answer, D. All of the above. All of the above interventions are excellent tension reduction techniques for the patient in the ICU. Others include walking the hallway, watching the television for distraction, writing in a journal, and asking for a PRN medication. When the plan of care is being developed, patient input should be obtained regarding what triggers create an episode of aggression, and what tension reduction techniques have been most effective in the past. Patients who are in the midst of escalation are often unable to recognize the need for a tension-reducing intervention. Therefore, it is very helpful for staff to be able to both recognize potential triggers and offer appropriate tension reduction techniques that have been individualized to the patient's needs. 56. Which of the following mental health situations is considered a psychiatric emergency? Seasonal affective disorder, SAD. B. Depression with melancholic features. C. Major depressive episode with psychotic features. D. Bipolar depression. Correct answer, C. Major depressive episode with psychotic features. Major depressive disorder, MDD, with psychotic features is considered a psychiatric emergency which may require hospitalization. There are a variety of depression classifications, which include major depressive disorder, MDD, depression with melancholic or catatonic features, atypical depression, psychotic features, bipolar depression, single or recurrent episode, dysthymia, and seasonal affective disorder, SAD. As many as 66% of people who have depression don't realize it may be treatable, and therefore do not seek help. 57. A nurse is reading a rhythm strip from a cardiac monitor. She counts 6 QRS complexes within a 6-second strip. What is the heart rate? A. 36 BPM. B. 60 BPM. C. 100 BPM. D. 120 BPM. Correct answer, B. 60 BPM. A nurse can calculate a client's heart rate per minute by assessing a 6-second strip from the cardiac monitor. The nurse should multiply the number of QRS complexes within 6 seconds by 10. In this scenario, 6 QRS complexes multiplied by 10 equals 60 beats per minute. 58. All of the following are complications associated with hypothermia during the perioperative period except decreased blood urea nitrogen levels. B. Cardiac arrhythmias. C. Decreased immunity. D. Increased oxygen needs. Correct answer, decreased blood urea nitrogen levels. Clients are at increased risk of developing hypothermia during the perioperative period when they are exposed to cool temperatures for long periods of time or they receive large amounts of fluids that may lower core temperatures. Hypothermia during the perioperative period places a client at increased risk of cardiac arrhythmias, decreased immunity, poor renal perfusion, and a decreased ability to metabolize medications. 59. A nurse is caring for a client who had a bone marrow transplant 2 weeks ago. Which of the following is most likely to cause an infection during this time period? A. Cytomegalovirus. B. Varicella zoster virus. C. Herpes simplex virus. D. Hepatitis B virus. Correct answer, C. Herpes simplex virus. A client undergoing a bone marrow transplant is at higher risk of developing an infection due to neutropenia. Many clients undergo chemotherapy and radiation prior to receiving a bone marrow transplant. The first 30 days following the transplant is known as the pre-engraftment period. During this time, a client is more susceptible to certain types of infections, including fungal, bacterial, and infection with the herpes simplex virus. 60. Which of the following actions is part of suture removal for a client following surgery? A. Cut the suture and pull the wire through the wound. B. Avoid removing further sutures if wound dehiscence occurs. C. Do not remove sutures that are embedded in the skin. D. All of the above. Correct answer, B. Avoid removing further sutures if wound dehiscence occurs. A nurse may remove sutures for a client following surgery if the physician orders this procedure. Using a suture removal set, the nurse should cut the suture away from the skin and avoid pulling the wire through the wound. If the wound edges begin to pull apart, suture removal should be discontinued until the physician has been notified. 61. Which of the following statements best describes postural drainage as part of chest physiotherapy? A. Tapping on the chest wall to loosen secretions. B. Squeezing the abdomen to increase expansion of the upper chest. C. Using gravity to move secretions in the lung tissue. D. Dilating the trachea to facilitate better release of secretions. Correct answer, C. Using gravity to move secretions in the lung tissue. Postural drainage is a type of chest physiotherapy used in clients who need to move fluid or secretions that have accumulated in the lungs. This method involves positioning the client in various manners that use gravity to move fluid away from the areas of accumulation. 62. Mr. R has come into the emergency room after an injury at work in which his upper body was pinned between two pieces of equipment. The nurse notes bruising in the upper abdomen and chest. He is complaining of sharp chest pain. He has difficulty with breathing, and his trachea is deviated to the left side. Which of the following conditions are these symptoms most closely associated with? Left-sided pneumothorax. B. Pleural effusion. C. Atelectasis. D. Right-sided pneumothorax. Correct answer, D. Right-sided pneumothorax. Mr. R is most likely suffering from a right-sided pneumothorax. Symptoms include sharp chest pain, difficulties with breathing, decreased vocal fremitus, absent breath sounds, and tracheal shift to the opposite of the affected side. 63. The physician has decided to perform a thoracentesis based on Mr. R's assessment. Which of the following actions from the nurse is most appropriate? A. Instruct the client not to talk during the procedure. B. Assist the client to lie face down on the bed. C. Insert a 20-gauge needle just above the fourth intercostal space. D. Connect the needle to suction to remove air that has collected in the pleural space. Correct answer, A. Instruct the client not to talk during the procedure. The nurse should provide a rapid explanation and ensure that consent forms are signed for a client undergoing a thoracentesis. Mr. R should be instructed not to talk or cough while the physician performs the procedure. 64. A systolic blood pressure of 145 mm of mercury is classified as A. Normotensive. B. Prehypertension. C. Stage I hypertension. D. Stage II hypertension. Correct answer, C. Stage I hypertension. Normotensive is a systolic pressure less than 120. Prehypertension is a systolic pressure of 120 to 139. Stage I hypertension is a systolic pressure of 140 to 159. Stage II hypertension is a systolic pressure greater than 160. 65. You are caring for Thomas N. Thomas is 77 years old. He has edema, or swelling, in his legs, and he has a fluid restriction in terms of his fluid intake. You have been assigned to weigh him daily. Based on these symptoms and the care that he is being given, what disorder is he most likely affected with? A. Diabetes. B. Dementia. C. Congestive heart failure. D. Contiguous heart disease. Correct answer, C. Congestive heart failure. Thomas N. has the symptoms and care indicative of the fact that Thomas has congestive heart failure, not dementia or diabetes. People with congestive heart failure, CHF, have dependent edema of the legs. They have too much volume in their blood, so the person will have a fluid intake restriction and a low salt diet. The person will also get daily weights to determine how much water weight the person is gaining or losing each day. 66. Your patient has just died from a massive heart attack. As far as you know, patient had no other diseases, illnesses, or infections. Should you still use standard precautions as you provide post-mortem care? A. Yes, because the patient must be treated with respect. B. Yes, you still must use standard precautions. C. No, because the patient had no infections. D. No, because this is not respectful. Correct answer, B. Yes, you still must use standard precautions. You must still use standard precautions for all people at all times. 67. The proper personal protective equipment necessary for collecting a sputum specimen would include, choose the best answer. A. Gloves and face mask. B. Level 3 bio-containment uniforms. C. Eye protection and shoe covers. D. Splash shield and face mask. Correct answer, gloves and face mask. Sputum samples could contain potential airborne droplets that may spread disease. Using a face mask and gloves will prevent the spread of infectious agents by protecting the respiratory tract, and gloves will prevent the spread of contaminants by the hands. 68. Surgical asepsis is being performed when wiping down exam tables with bleach. B. Sterilizing instruments. C. changing table paper. D. Wearing gloves when performing injections. Correct answer, B. Sterilizing instruments. Surgical asepsis is the process of preventing pathogens from entering a patient's body. This is done by using sterilization procedures. 69. The most effective step of hand washing is using friction to remove potential pathogens. B. Using hospital-grade soap. C. Moisturizing the hands after washing to prevent cracking. D. Washing hands for at least 15 seconds. Correct answer, using friction to remove potential pathogens. While all of the answers are part of an effective hand washing procedure, the use of friction when washing is the most effective method of removing debris and potential pathogens from the hands. 70. MSDS sheets contain the ordering information for each piece of equipment in the office. B. Are required by OSHA to be accessible to all employees of the office. C. Can be used to treat patients who have been injured in equipment accidents. D. None of the above. Correct answer, B. Are required by OSHA to be accessible to all employees of the office. Materials safety data sheets are used to provide employees information on all chemicals that are used in their place of work. Health information is readily accessible and can be used to help employees who have been injured by the use of these chemicals. 71. The most virulent blood-borne pathogen is. Choose the best answer. A. HCV. B. HPV. C. HAV. D. HBV. Correct answer, A. HCV. Hepatitis C is 100 times more virulent than hepatitis B, 72. The NFPA diamond has 4 colors. The blue diamond, A, indicates hazards to health. B, designates that it is safe to use water to put out this type of fire. C, indicates that ice is necessary to treat an injury with this type of chemical. D, indicates that the chemical may be incinerated upon disposal. Correct answer, A, indicates hazards to health. The National Fire Protection Agency has designated a safety diamond to be used to indicate the threat level of a particular chemical. The blue diamond indicates potential hazards to a user's health when the particular chemical is used. 73. Exhibit 2, ECG Interpretation 1355. Sinus tachycardia with frequent premature ventricular contractions. The unlicensed assistive personnel perform the ECG on the client. See Exhibit 2. Which of the following current findings is the most concerning? A. Deformity of the left ankle. B. Sinus tachycardia with PVCs. C. Anxious appearance. D. Puncture wound over right knee. Correct answer, B. Sinus tachycardia with PVCs. The client's cardiac rhythm is most concerning. The nurse notes the client is in sinus tachycardia, which could be due to anxiety after the accident. However, the sinus tachycardia rhythm could also indicate the client is experiencing shock, and the client was involved in a traumatic injury. Therefore, the nurse should be concerned about injuries that are not visible, contributing to the client's increased heart rate. In addition, there are frequent PVCs noted in the client's cardiac rhythm. The nurse should be concerned about chest trauma contributing to the disruption in the electrical activity of the heart. If the client has 3 consecutive PVCs in a row, this is considered ventricular tachycardia, which can be a lethal rhythm. The puncture wound is a concerning finding but not the most concerning. The bleeding is controlled, therefore, the puncture wound does not take priority. The nurse is primarily concerned about the client's cardiac rhythm, which could indicate the client has had a chest injury disrupting the electrical activity of the heart. This disruption could lead to lethal arrhythmias. 74. Exhibit 3, Vital Signs 1355, T, 36.4, 97.5 degrees Fahrenheit orally, HR 118 BPM. BP 162/98 mmHg, RR 20 breaths/min, pulse oximetry 97% on room air, pain 1010. Regarding the current assessment findings and vital signs, which of the following is the most important question for the nurse to ask the client? A. Have you ever been a smoker? B. Do you have any medical history? C. Why is your blood pressure so high? D. Are you feeling any current palpitations? Correct answer, B. Do you have any medical history? The most important question for the nurse to ask the client is if the client has any medical history, specifically cardiac. It is important to be able to determine if the accident contributes to the client's current cardiac rhythm. If the client has experienced any cardiac rhythm disturbances in the past, this could change the client's current treatment plan. In addition, certain cardiac conditions could predispose the client to rhythm disturbances, which would be necessary for the healthcare team to know about to determine the proper treatment plan. Answer C is incorrect. It is inappropriate for the nurse to ask the client why their blood pressure is high. The more appropriate question would be if the client has a cardiac or high blood pressure history. The client's elevated blood pressure could be due to multiple reasons, including pain. It is not the client's responsibility to determine why their blood pressure is elevated after experiencing a traumatic injury. Answer D is incorrect. Asking the client about palpitations is an important part of the client's assessment. It is not uncommon for a client with PVCs to experience palpitations. However, there are more important questions for the nurse to ask in the current stage of the client's treatment. The nurse needs to determine if the client's current cardiac rhythm is a new finding or if the client has experienced this issue in the past. 75. Exhibit 4, Provider's Prescriptions/Orders 1406, Establish for Access. CBC, BMP, PT/PTT, INR, troponin. Urinalysis. CT chest/abdomen. X-ray of the left ankle and right knee. 50 micrograms for fentanyl stat. 1,000 milliliters of 0.9% sodium chloride. The healthcare provider assesses the client and places prescriptions. Which additional laboratory tests should the nurse plan to obtain and discuss with the healthcare provider while establishing the 4? A. Blood cultures. B. D-dimer. C. Type and screen. D. Bedside glucose. Correct answer, C. Type and screen. The nurse draws a type and screen in the event that the client needs a blood transfusion. A client that has a fracture from a traumatic injury can commonly have multiple other injuries or fractures. Some fractures result in more bleeding than others, and the bone is vascular. For example, pelvic fractures can result in hemorrhage and hypovolemia. Answer A is incorrect. The nurse is concerned about the possibility of infection from open wounds. However, blood cultures help determine if the client is experiencing sepsis. The client is at risk for infection. However, there is no current concern that the client is experiencing sepsis. The client might receive prophylactic antibiotics, and the wounds should be cleaned and covered for infection prevention. Answer B is incorrect. The nurse would not plan on drawing a D-dimer. A D-dimer is a byproduct of a blood clot. The nurse is currently more concerned about hemorrhage and bleeding rather than clotting. A venous thromboembolism is a complication that can occur in musculoskeletal trauma or surgery, and the nurse will monitor for this potential complication. However, the nurse's immediate concern is excessive bleeding from trauma. Answer D is incorrect. The nurse would not obtain bedside glucose since the client is alert and oriented, and the glucose will result in the client's BMP. If the client were altered or unconscious, glucose would be a high priority. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.